Dr Melanie Davis-Hall is a women's health and contraception expert, clinical editor for the British Medical Journal, and in-house GP at the Lowdown. The Lowdown is a contraception review platform and community which offers expert advice about all forms of contraception.
Loads of women have quite rightly taken to responding to the MHRA, which is the Medicine Health Regulation Authority, to say if they've experienced any changes to their periods after having the COVID vaccine. It's possible there's a link. We don't know whether it's a side effect of the vaccine because it wasn't studied in the clinical trials. So it wasn't studied where you compare a vaccine group against a placebo group and look at the rates of that occurring in each group. So we can't say it is a vaccine because it's not been studied. There's lots of reasons why that might be, stuff that I'm really interested in as a doctor as well. No previous vaccination has had this level of media scrutiny. We know that menstrual changes have occurred, linked with the HPV vaccine, with the flu vaccine before. But what might be happening now is with such intense scrutiny, and women are being told to be hypervigilant for side effects and symptoms. Are women actually just noticing changes that might have occurred anyway? And perhaps that's what I've noticed from this, is that it's the discourse that we've had around menstrual irregularities, things that actually in the medical profession we know occur often, but perhaps we just don't talk about enough normally to recognise that. So many women experience temporary changes in their periods from time to time in their lives. Menstrual disorders are really common. Loads of things can change your periods. So changes in weight, excessive exercising, under eating, changes in your mood, depression, chronic illness, infections, all those things can change your period. It's kind of a barometer for your health, your period, kind of reflects what else is going on. I suppose I can't say why they didn't study it. They studied things that were sort of the most obvious, so asked about the most obvious side effects, things there was sore arm, fever, headaches, aching, things that they would expect. I guess by not asking about the menstrual cycle, it's maybe a topic that people who were involved in the trials didn't necessarily volunteer. It's a subject that people don't often talk about. So perhaps women put it down to, it's just my normal menstrual cycle. I'm used to changes in my menstrual cycle. They didn't report it. We think it probably reflects a certain gender bias in clinical trials, and shows there's a lack of emphasis on the importance of reproductive health. And I think that's why there's a lot of fear and anxiety around this, because it's not spoken about. I think it would be good, and something that we want to see is for clinical trials to ask these questions in the future, not necessarily looking for there to be a problem or expecting there to be a problem, but just so that if there are irregularities or changes that that we can write them down, even in the leaflet around the vaccine. We can say these might change your menstrual cycle. These are the times when you need to seek help or seek advice about it. We doctors want to know if you've had changes to your menstrual cycle that persist beyond a couple of periods or any unexpected vaginal bleeding. So yeah, in my professional opinion, I would advise women to have the vaccine because the consequences of the COVID-19 infection are life-threatening and long-lasting in some people. And if you have any concerns about menstrual problems, either before or after having the vaccine, then speak to your GP and hopefully they can allay your fears.